He was scheduled to be born on the 26th of June.
He was right on schedule.
Right on schedule. And the doctor said, "You're really not ready to deliver. Why don't you take a ride, go over bumpy roads or whatever?" So we drove all around the town. And nothing seemed to change much. They're just reluctant to come around. Gary was...
He wasn't reluctant. He did everything he could.
We don't know about that.
He was perfect. Right on time.
I thought he was very handsome. He was skinny, and he was awkward, and he was funny, and he was smart. So, you know, and I was young. What did I know?
My son's diabetic, and they were doing good work up at the Virginia Mason Research Center. And so that was how we first got connected.
He introduced himself. Before he said he was CEO of Virginia Mason, he said he was a season ticket holder.
Really, there's only about a dozen serious groups of diabetes researchers around the country, and Virginia Mason's definitely one of them.
You know, as a kid at 9, my mother came home from a hospital, and back then the hospital didn't solve this issue. She died, you know, and my stepmother the same. So hospitals were scary places for me, and but they're not anymore. And you know, one of the interesting things I have is I get to learn a little bit about a lot of different things, and so learning about Virginia Mason, watching them endeavor to provide better care, to challenge the status quo, to challenge efficiency and a whole new way of delivering health care.
You know, I think it's a huge thing in America that if you don't have health insurance, you have a whole different style of life compared to people who do. It's a serious problem.
It shouldn't be that way, but yeah. I know that I have a little carpal tunnel and had problems, and if I call the doctor, I don't get any results. But if Gary calls, they get back to me immediately, even back home, if they get a phone call from Gary.
But the medical care that is available,
it's
Virginia Mason,
it shouldn't be that way.
And actually, that's a pretty cool thing about Gary Kaplan. I know he's one of the founding CEOs of healthcare reform and having access for everyone.
We chose to go into healthcare because we wanted to help people, because we wanted to make a difference. But at the end of the day, we're human beings. And when you have a payment system that incentivizes the wrong thing, and you have an industry that is not 100% evidence-based, we only have incontrovertible, double-blind controlled evidence for a third of what we do.
He sees patients 2 half-days a week, and it's very important to him, extremely important to him, that he continues to see patients. And it's part of the Virginia Mason philosophy, and he loves seeing patients.
Gary's got me into a system now at home that's similar to Virginia Mason because he likes that idea of carrying it through.
Team medicine.
Team medicine.
I think his going to Japan and studying the Toyota system is inspired.
It's the satisfaction of changing an organization to something positive, but you know, we're changing the world, making the world a better place, but also the ability to change people's lives.
Our medical care, as he tells me, we spend more per person than any other country in the world, and we're not getting our money's worth. We still have 47 million that aren't insured at all. There's enough money being spent, but how it's spent and the waste and inefficiencies can make the big difference.
Somebody's got to lead the way. Somebody's got to be willing to call the question.
There's certainly material possessions, and a lot of us spend a lot of time working towards what would appear to be goals that are materially based, but the most rewarding goals are spiritual.
If you could only. My name is Brent Wilson. I am a retired plumber. I moved here due to being diagnosed with ALS.
My name is David Wheeler. I'm born and raised here in Seattle. I came here after getting a virus called Guillain-Barré syndrome, where I literally woke up one morning and I couldn't walk. At one point, every muscle in my body was frozen, and it worked its way up to my chest and it froze my lungs. So I couldn't breathe, and they had to put a trach in.
I said, okay, I've been diagnosed with a life-ending disease. I can either spend the rest of my life living, or I can spend the rest of my life existing and fighting to exist.
I had a hand infection. That's from the virus.
That's 1 day's worth of meds for one of our clients.
It affected my speech, my, motor skills, and my memory. It's coming back, though, little by little.
I mean, to my knowledge, there isn't anywhere in the country that's doing the type of work we're doing here.
I went to college. I was a very good student.
It was the first facility opened in the early 90s that was absolutely dedicated to folks that had been diagnosed with HIV/AIDS, and it was a place for them to come and get specialized care for their needs.
Somebody decided to do this. Somebody had an idea, you know, to help others.
I had never even knew that a place like this could exist.
It's a very important place. It's very unique because it's very caring, and they're very efficient at what they do.
I don't know if there's anything else that anybody else can do except help somebody else, you know what I mean?
If we don't care about people and who are having difficult times and a hard life, then our soul suffers a little bit.
I'm doing what I know I need to do to have a good, fulfilled life today, at this moment, right now.
This place is what keeps me sane. This place also is what has helped keep me alive.
Why care about the people in Darfur? You gotta dig deep and decide for yourself what's important.
Don't take things for granted. Don't take people, places, and things for granted. Treasure what you have. Treasure your family.
Have hope for the future, dream.
I think the most important thing is that you gotta believe in yourself. And when you're believing in yourself and you're listening to that little voice inside your head that's telling you to do the right thing and you act on it, you're gonna make a difference in yourself and probably someone else's life.
There's several years ago where we didn't think this organization was going to survive. And myself, our board, all thought that the organization did not have what it needed to stay around. And it was Gary Kaplan and, in conjunction, Sarah Patterson, that said, no, keep trying. It's going to work. So just when we had given up hope, he still had the hope and encouraged us to go on.
We are a community in Seattle, community here at Baylor Boucher House. Wherever you are, you're in some community. And I want people to build a community that's positive and healthy and to have fun. You gotta have fun through it all.